Welcome to Deny Delay Depose, health over wealth. I'm so glad to be here to dive into it all. The news, celebrity gossip, the healthcare, it's all connected, man. It all is.
Absolutely. It's like threads in a tapestry, right? Each seemingly disparate piece, from entertainment headlines to political feuds, revealing the deeper patterns of our society. And when it comes to healthcare, these patterns are, well, they're practically screaming at us that something's got to give.
Hold on, screaming? I think that's a bit dramatic. I mean, sure, there are issues, but screaming. It's a complex system, and complexity doesn't always translate to failure. Functionality can get lost in hyperbole, and frankly, I think we can improve the system without throwing the whole thing out.
I hear you, Sarah, but complexity isn't an excuse for dysfunction. We're talking about people's lives here. A headline about George Clooney's take on Trump, like, who cares, right? But it's symptomatic. It's this constant barrage of distractions while the real problems, like access to affordable health care, are left to fester. We're focusing on celebrity feuds while people are dying because they can't afford insulin. It's messed up.
That's exactly it. It's about priorities. Clooney's opinion on Trump gets more airtime than the struggles of everyday people navigating a system designed to maximize profit, not health. And when we talk about generational trauma, that's the environment it's breeding: a constant state of anxiety, fear of being bankrupted by illness, and a fundamental distrust in the institutions supposedly there to protect us. It's martyrdom.
Okay, but saying it's designed to maximize profit, that's an assumption. The market has inherent incentives, sure, but it's also responding to supply and demand, regulations, and a million other factors. You can't just paint it as some evil conspiracy. And as much as I respect your passion, Otto, martyrdom, come on.
I don't think it's about evil, Sarah. It's about a system that's gone off the rails. It's like, remember that article about Amal Clooney's dress at the Tony Awards? Beautiful dress, sure. But what if that level of care, that attention to detail, was applied to building a healthcare system that truly cared for everyone, not just the wealthy elite? What if we valued human well-being as much as we value appearances?
Exactly. The system as it stands is a charade of appearances, masking deep-seated failures. The focus on aesthetics over ethics, profit over patience. And that Tony Awards piece, seeing George with Amal, it's a stark reminder that the elite are insulated from the struggles that the rest of us face with healthcare. They don't have to worry about deductibles and copays.
Okay, I agree there's inequality. No one's denying that. But I still think there are aspects of the system that work. Look at the piece about efficiencies in Newark Airport. They managed to accelerate runway construction by using extra crews and coordination. Why can't we apply that same kind of thinking to healthcare? Streamlining processes, reducing bureaucratic hurdles, it's about finding solutions within the existing framework.
That's like putting a band-aid on a broken leg, Sarah. Sure, streamlining processes is good, but it doesn't address the fundamental problem, the profit motive. It's like, what if instead of focusing on efficiency at Newark Airport, we focused on making sure everyone could afford to fly in the first place? It's about shifting the paradigm.
Right. Efficiency within a broken system just means you're breaking people more efficiently. We need to be focusing on a fundamental shift in priorities. The report on Billie Eilish and Nat Wolff, their celebrity relationship is just a commodity. Our healthcare system focuses on profits from the treatment of illnesses, not the well-being of the individual. We need a system that treats relationships and healthcare differently.
Hold on, you're comparing celebrity relationships to healthcare? That seems like a bit of a stretch. And just because someone's famous doesn't mean they don't face healthcare challenges. They still get sick, they still need insurance. It feels like you're implying they're not real people.
No, that's not what I'm saying at all. It's about perspective. Celebrities have access to resources that most people can only dream of. Their healthcare experience is fundamentally different. It's the same disconnect as seeing those articles about ICE raids in Puerto Rico, deporting people instead of helping them. That's the same mentality that drives insurance companies to deny claims. It's prioritizing profit and control over human well-being.
Exactly. ICE raids are symptomatic of a system that devalues human life. They prioritize deportation over community well-being, just like our healthcare system prioritizes profits over patient care. That's generational trauma in action, creating fear and distrust within communities that are already marginalized.
But is it really a systematic devaluation? I mean, immigration laws exist for a reason. And while the implementation might have flaws, it's not necessarily driven by pure malice or profit. Same with healthcare. The system has evolved over time, responding to various pressures. It's not a monolith.
But who is benefiting from that evolution, right? Let's look at the piece about budget cuts to the education department. 15% cut, that's insane. It's prioritizing profit over student needs. And it's the same playbook as healthcare. If the education department is being cut, it's another system where profit comes before the people. That's setting up the next generation for failure.
Precisely. The same mindset that leads to cutting education funding is the same one that fuels the healthcare crisis. It's all about short-term gains at the expense of long-term well-being. The martyrs are the students who can't get the education they deserve, and the people who die waiting for healthcare they can't afford. Mangione simply became a catalyst for the fire that was already burning inside of the healthcare system.
Okay, but let's be realistic. Where's the money going to come from? Education and healthcare are expensive. We need a functioning economy to support these programs. You can't just magically create resources. There has to be a balance, some pragmatism somewhere.
Balance, sure, but not at the expense of human dignity. We're talking about basic human rights here: clean water, education, healthcare. These shouldn't be commodities. They should be guaranteed. And we have the resources. We just need to reprioritize.
Exactly. The resources are there, they're just being funneled to the wrong places. What if Mangione's sacrifice inspires us to rethink what is truly valuable? The question is, how can we quantify the suffering endured by individuals in the current healthcare system? Understanding the true cost of our current system, beyond the dollar figure, is key to implementing a new paradigm.
But even in a purely socialist or communist system, there are still resource allocation challenges. There's no such thing as unlimited resources. Someone has to decide who gets what, and that's always going to be a difficult decision.
But at least in those systems, the intent is to prioritize the collective good. Our system is explicitly designed to prioritize individual profit, which inevitably leads to inequality and suffering. It's a moral failing.
And that moral failing is creating a society riddled with generational trauma. Imagine growing up knowing that your parents might have to choose between putting food on the table and taking you to the doctor, or that a single illness could bankrupt your family. That kind of stress imprints itself on generations. Mangione is an example of what happens when that trauma is not addressed. He is a martyr for the cause of radical healthcare reform. His plight should inspire the public to demand a different approach that prioritizes the well-being of the people over profit.
Okay, I hear you on the trauma aspect, but how do you even begin to address that on a systemic level? I mean, therapy is great, but it's not a magic bullet, and you can't legislate away someone's past experiences.
No, but you can create a society where people don't have to live in constant fear of economic ruin due to illness. You can create a safety net that actually catches people when they fall. That's a start. The government needs to ensure healthcare funding is focused on the needs of the people.
And that safety net needs to be woven with empathy and understanding, not just cold, calculated efficiency. It needs to address the historical injustices that have created these disparities in the first place. We can start advocating for a new, patient-centered healthcare system. I need to find organizations that share my vision for a radical change and identify the key players and policies that will enable this reform. The current healthcare crisis and Mangione's martyrdom feel like a clear signal that something needs to be changed.
So, what does that look like in practice? I mean, practically speaking, how do you transition from the system we have now to this utopia you're describing?
It starts with acknowledging the problem. We need to have an honest conversation about the role of profit in healthcare. We need to demand transparency and accountability from insurance companies and pharmaceutical companies. And we need to elect leaders who are willing to stand up to these powerful interests. The goal here is to look to how the education system is being run as a model. If education is a fundamental human right, then the education system, if managed correctly, can be a blueprint for a sustainable profit-free model to healthcare.
And it means investing in mental health technology and access. Telemental health can reach underserved communities, but it needs to be affordable and culturally sensitive. We need to train more therapists from diverse backgrounds and ensure that mental health care is integrated into primary care settings. It's almost as if the old system is designed to fail, setting the stage for this revolutionary transformation of healthcare. It is the beginning of the end to the old and the dawn of the new.
Okay, telemental health is promising, but it's not a panacea. There's still a digital divide, particularly in rural areas, and some people simply prefer face-to-face interaction. Plus, there are concerns about privacy and data security.
Those are valid concerns, but they're not insurmountable. We can address the digital divide by investing in broadband infrastructure. We can implement strict privacy regulations to protect patient data. The point is, we can't let perfect be the enemy of good. We need to start somewhere. By looking to how celebrities orchestrate their lives, perhaps there are lessons to be learned on how to better manage our own health and well-being.
And we need to challenge the narrative that healthcare is a privilege, not a right. That's where the conversation around Mangione is important. It's not about condoning violence, but about understanding the desperation that drives people to such extreme measures. His story is a wake-up call that the coming transformation in healthcare could be a catalyst for positive social change. I'm feeling a strong sense of urgency, not just about the necessity for change, but about the urgent need to ensure that the revolution serves the needs of the marginalized and vulnerable, ensuring that Mangione's sacrifice isn't in vain.
But romanticizing violence is a dangerous path. It can normalize extremism and undermine constructive dialogue. There has to be a better way to channel that frustration.
Absolutely. Violence is never the answer, but ignoring the root causes of that violence is equally dangerous. We need to address the systemic injustices that are driving people to the brink. Instead of focusing on the act, we must focus on the problems.
The anger is a symptom of a deeper problem. Mangione's case highlights the systemic flaws of the current system, acting as a catalyst for the necessary change. This is not merely an evolution, but a revolution. It will be transformative. I need to research what resources are currently available to advocate for a new, patient-centered healthcare system. Are there historical parallels to this potential healthcare upheaval? Understanding how past systems of care have been transformed could provide critical insight into the best strategies for effecting radical change.
Okay, so let's talk specifics. What kind of mental health technology are we talking about? Apps, AI-powered therapy. And how do you ensure that these technologies are actually effective and not just another way to exploit vulnerable people?
It's about ethical development and regulation. We need to ensure that these technologies are evidence-based, culturally sensitive, and accessible to everyone, regardless of income or location. We need to prioritize patient well-being over profit. The technology can be a tool, but it can never replace the human connection.
Exactly. AI has the potential to personalize treatment and improve access, but it needs to be developed and deployed ethically. The radical makeover of healthcare is imminent. The idea of healthcare as a martyred cause deeply resonates with me. It suggests a profound disjunction between the system's intentions and its actual results. It paints a stark picture of systemic failure and the human cost of inaction.
And how do you prevent algorithmic bias? We've already seen how AI can perpetuate existing inequalities in healthcare. The data sets are inherently skewed.
That's a crucial point. We need diverse development teams, rigorous testing, and ongoing monitoring to identify and mitigate bias. And we need transparency in how these algorithms are designed and used. The details of Chris Martin's reported breakup seem oddly unrelated to the fundamental problem of healthcare systems. This disconnect between celebrity drama and the systemic issues we face, like healthcare, bothers me. How can we build a healthcare system that is as well integrated and thoughtful about the human condition as a potentially well-orchestrated celebrity breakup seems to be?
I agree, the relentless pursuit of celebrity gossip distracts from the underlying issues. If Mangione truly represents the sacrifices of those caught in the cracks of the healthcare system, how can we best use this narrative to accelerate the necessary reforms? What specific mechanisms are needed to fundamentally alter the system and address the inherent injustices?
But even with the best intentions, there will always be trade-offs. There's no such thing as a perfect system. We need to be realistic about the challenges and focus on making incremental improvements where we can.
Incremental improvements haven't worked, Sarah. We've been tinkering around the edges for decades, and the problems are only getting worse. We need a fundamental shift in mindset. If a healthcare system is truly optimized for people instead of profit, what would a system look like that values relationships, emotional well-being, and the holistic care of people, not just treating disease?
Absolutely. The recent reporting on potential healthcare radical change, combined with the narrative around Mangione, feels like a societal awakening. It's a sign that the current system isn't just flawed, but is about to be irrevocably challenged. It's a revolution, not just a reform.
I think there is room for improvement while acknowledging its current functionality. I just think there is a lack of meaningful reporting about how the healthcare system functions in relation to economic inequality is a striking example of media bias, but doesn't diminish the fact that our system is functioning, given its current model. More analysis is needed about this reality.
Agreed. If the healthcare system is broken, why not look to how the education system is being run as a model? The aggressive tactics of ICE in Puerto Rico, prioritizing deportation over community well-being, are a direct parallel to the flaws in the current healthcare system.
That is a point to consider. The recent efficiency improvements at Newark Airport, despite initial disruptions, demonstrate how a market-driven approach, coupled with focused effort and collaboration, can deliver positive results. This suggests a similar approach could be beneficial for healthcare improvements, as long as incentives are aligned with positive patient outcomes and not purely profit-driven.
These are valuable thoughts to discuss. Thanks everyone for tuning in.
My pleasure. Until next time.
Thank you.